Hope your week is off to a good start. You're watching Arirang TV's special coverage of COVID-19. I'm Min Sun-hee. The total number of global infections stands at over 10 million as of this past weekend, while the death toll has hit more than 500,000 worldwide. Now, these grave numbers come less than 6 months after the confirmation of the initial cases of the virus. Now, we have more on the latest developments with our Kwon So-ah and Oh Jung-hee on this Monday. Let's begin with the latest updates on the pandemic here and elsewhere around the world. So-ah, how are we starting the work week?
Hi, Sunny. Well, as you just mentioned in the opening, we have more than 10 million cases worldwide. That milestone has been hit over the weekend. So cases are still accelerating, but not so much here in the country. So let's start off with our domestic updates. We have 42 new cases as of 12 a.m. this Monday. That brings the total to 12,757, and 30 of those cases are local infections, while a dozen were imported cases. And the death toll stands at 282. That remains unchanged since Friday, while we have 1,046 people who are still in quarantine and 11,429 people who made a full recovery from the virus, as 65 more people have been discharged from hospital in the span of a day. Now, although we are down to below the 50s, compared to Monday last week when we were down to 17 cases, that is an on-week jump we're seeing, but the good news is that the number has dropped from the 50s and 60s we had over the weekend. And now let's get a check of the global updates. As we have been predicting last week, also by the World Health Organization, the 10 million mark has been surpassed over the weekend, and that is as some 163,000 cases were added on Sunday, and as of 12 p.m. Korea time, we have over 10.2 million cases, and also the fatality stand at over 500,000. And now let's move over to some countries with major outbreaks. We have the U.S. here with over 2.6 million cases and more than 128,000 mortalities. And around half of that figure we have in Brazil with 1.3 million cases, and Russia followed with 634,000 total infections. And the concern is here over in India, which now has almost 550,000 cases, as some 38,000 cases were added on Saturday and Sunday. And moving over to other places, we have Peru with almost 280,000 total infections of COVID-19, followed by Chile at almost 272,000. And another significant change we have here down in Pakistan, which has almost 203,000 cases, as it has been seeing surges in numbers recently, surpassing Turkey and Germany over the weekend. And those are the latest figures, but I'll be back in a bit.
All right, so thank you for that. I'll see you at the desk after the regular briefing. Right, as acknowledged on quite a few occasions, COVID-19 has changed the dynamics of international diplomacy, with a tangible illustration being the surging number of online interactions as opposed to offline meetings. For more on this reality, I have our Foreign Ministry correspondent Oh Jung-hee here in the studio with me. Welcome, Jung-hee.
Good afternoon.
Right, Jung-hee, so let's begin with Seoul's diplomatic efforts amid the pandemic. I understand K-quarantine has been the main item on its agenda.
Right. Usually, South Korea would be dealing with some denuclearization talks with North Korea, its bilateral relations with surrounding countries and the U.S. But after the COVID-19 pandemic, Seoul has shifted its focus to promoting its K-quarantine model. Remember, South Korea was one of the first countries to be hit by COVID-19. It saw hundreds of new daily cases in late February to March. But after bringing that figure down to dozens to a few and successfully flattening the curve, South Korea has been working to share its knowledge with other countries on how it achieved that, while stressing the values of transparency, openness, and democracy.
Right, transparency, openness, and democracy. Chung-hee, how has that been done specifically?
Well, the government has been holding online web seminars every 1 or 2 weeks involving officials who work in the field and can explain things in detail. The topic is different every time, ranging from crisis management, testing and treatment, entry procedures, and whatnot, and anyone can watch it no matter where they live across the world. Knowledge sharing through official diplomatic channels has also continued. For example, because South Korea successfully held its general election in mid-April without seeing any spike in new cases, the government has shared its relevant know-how with the U.S. and Central American countries.
Right, and Chung-hee, Seoul has continuously been speaking against the shutting of borders and has instead been supporting solidarity among nations. Please tell us a bit more about that.
Right. Thanks to South Korea's successful containment measures, South Korean President Moon Jae-in had the opportunity to make a keynote speech at the World Health Assembly for the first time as the sitting South Korean president. And here, his message was that the global community must choose solidarity and cooperation over the pursuit of individual interests. Going in line with that, South Korea led the founding of 3 international support groups in total, one each in the UN, WHO, and UNESCO. These to strengthen cooperation and health security while preventing discrimination and xenophobia.
Now, while encouraging international collaboration, I hear South Korea has also been sending medical equipment overseas.
Right. Exports of surgical masks had actually been restricted since March because that was just when the coronavirus outbreak just started, and there was also a surge in domestic demand. Up until 2 weeks ago, only 10% of surgical masks could be shipped overseas, and right now 30% of them are allowed for exports. The U.S. and Japan are the largest buyers, but the government did provide them on an emergency basis if deemed necessary. 3 million masks were sent to China and 2 million to the U.S. 73 types of test kits are currently being exported to roughly 110 countries around the world, which has enabled COVID-19 testing for over 56 million people.
Right. Now, as I mentioned at the start, amid the pandemic, face-to-face diplomacy has been halted, but Seoul is now cautiously looking to resume such interaction.
Right. Earlier this month, South Korea's Deputy Minister for Political Affairs traveled to the United Arab Emirates to discuss setting up a fast-track entry system for business travelers from both sides. Now, that was the first time a senior South Korean diplomat had traveled overseas since COVID-19 became a global pandemic. Soon after, Seoul's top nuclear envoy flew over to Washington to discuss North Korea with his American counterpart. Of course, speaking online and through phones did not hinder diplomacy to a great extent, and it was rather a good opportunity for the governments to prepare for the post-pandemic era. But as Seoul's foreign ministry says, just as essential economic exchanges have continued through exemptions on travel restrictions, Seoul is also looking to resume face-to-face diplomacy with other countries, of course, with strict quarantine measures still in place.
All right, from Seoul's quarantine model to new trends in diplomacy, that was our Oh Jung-hee. Thank you for speaking with us, Jung-hee.
My pleasure.
Right, it's a little after 2 o'clock here in the afternoon in Korea, and we are poised to join the regular government briefing on COVID-19. As mentioned at the start of the program, the total number of global infections stands at over 10 million as of this past weekend, while the death toll has now hit over 500,000 worldwide. Now, these numbers come less than 6 months after the confirmation of the initial cases in China. Here in Korea, the metropolitan region appears to be witnessing a second wave, information that is, as observed by health authorities, with both sporadic cluster infections and imported cases keeping officials on high alert. Over the weekend, there have been quite a number of cases linked to churches in Seoul, renewing calls for online religious services as opposed to offline activities. Health officials have also announced a framework of 3 levels of quarantine regulations depending on the severity of the spread of COVID-19 in Korea. Now, level 1, which is our current status, means the cases, that is, the daily number of cases, is within medical capacity, and thus the current daily life quarantine measures are adequate. Level 2 is announced when the daily infections surpass 50, but hover below 100 for 2 straight weeks, that would be. Under this alert level, all private and public indoor gatherings of 50 or more people and outdoor gatherings of 100 will be banned. Level 3 means the daily infections stands at more than 100, and under such a scenario, gatherings of 10 or more people will be banned and schools will be closed. Now, we are still waiting for the briefing to commence, and perhaps while we do, we can take a look at the... No, we've just heard that the briefing is about to start. So while we wait, let's take a look at the numbers again for this Monday here in Korea. We have 42 confirmed cases in Korea, raising our total to 12,756. We have seen no death. Our death toll hasn't changed, that is, at 282. Now, those in quarantine stand at 1,046, while the number of those fully recovered has hit above 11,000. The briefing is about to start. I'll come back to you with the summary of that with our Khonsoa later.
First, here is Director Chung Eun-kyung with the explanation. Let us now begin a regular briefing on the COVID-19 response here in South Korea. As of June 29th today, we have 30 new local infections and 12 new imported cases, adding to a total of 42 new cases today, and the total number of confirmed cases now stands at 12,757. 65 more people have recovered, and a total of 89.6% or 11,429 have been discharged, and 1,046 people are in quarantine undergoing treatment. The death toll remains unchanged from yesterday. And here are some updates on the domestic infections. Related to the Hwangseong Church in Gwanak-gu District, Seoul City, we have one additional case, and the total now stands at 28. We have conducted the testings for over 1,700 people, and out of them, 1,600 have tested negative. And at the Seoul National Defense Ministry here in Seoul, we have carried out the epidemiological investigation for the kids at the nursing home, and we have confirmed that one person has been tested positive. And at the Gyeonggi-do Anyang City at the Lord Glory Church, we have 22 confirmed cases to date, and we are also conducting contact tracing, and the epidemiological investigation is also underway. Related to the Central Baptist Church in Suwon City, we have 4 new cases and a total of 7 cases, that is as of today, and we are also conducting active monitoring for all of the people who were present at the services. And also at Gwangju City, we also did an investigation into this family members who tested positive, and it was linked to a temple. And there was a total of 12 people testing positive. And so far, 76 people have been identified as contacts, and we are testing all of them as well. And yesterday, we had 12 new imported cases, and the countries were 3 from America, 1 from Europe, and from Asia, 2 from Philippines, 2 from Bangladesh, 2 from Kazakhstan, 2 from Russia, and 2 from Pakistan as well. And the KSDC, recently we have noted that the cluster infections are spreading through religious centers, including retreats and small religious group meetings, and we ask for the public's particular precaution. And we have confirmed 3 latest cluster infections at 3 religious centers, and we also have attached a table on the press kit. And in relation to the religious centers, we have found that many of the people did not wear their face masks, and meaning that they did not abide by the life quarantine measures, and they also engaged in droplet-inducing activities, including singing, chanting, eating together as well. And also we found that there were people who were present at the physical services even though they had symptoms. And as for religious centers and places of worship, they are clustered together within an enclosed space, and as they engage in activities like chanting, singing, and eating together, they have higher risks of infection. So therefore, we ask these religious groups to switch all of their retreats and gatherings to online alternatives. And also, if you have to have on physical services, we would like to ask you to reduce the number of participants and check the people's temperature as well as their symptoms. And please wear face masks. And please do not provide meals. And also, please do not engage in activities like singing or chanting that increase the respiratory droplets travel in air. And looking at the cluster infection for the past 2 weeks, we have found that a lot of them were related to cluster infections in the community and also imported cases. And this week, starting from Saturday to Sunday, on Monday, we will be disclosing the weekly analysis, and this will be provided to you on a weekly basis. So this is on page 15. You will see that there is a graph of the daily increase as well as a weekly increase. And you can see that we have a decline in the cluster infections in the communities. However, you see a trend of increase in the imported cases. The COVID-19 spreads, especially at environments that are closed, crowded, and close contact. And therefore, we ask you to postpone or cancel group gatherings and club meetings. And please do not refrain from visiting high-risk facilities, including singing rooms and so forth. And in your daily routines, you should also keep abiding by the personal hygiene measures, including wearing a face masks. And in relation to the EHEC syndrome in the Ansan City kindergarten, as after we have identified the first case of suspicious case, we are continuously monitoring the situation. And as of 28th June, 6 p.m., we have 114 people with suspected symptoms, and we have one additional patient, and the confirmed patient now stands at 58. Of them, we have 111 people who are the kindergarten students, and the rest are their family members. And also, we have identified severe symptoms within some of the students who are at the kindergarten, and we will be monitoring this going forward. And as for the cause of such syndrome and infection, we are collaborating with the Ministry of Food and Drug Safety in order to trace the causes, and in order to really prevent any further cases of EHEC syndromes, we advise you to cook well before you consume them, and you also need to keep sanitary conditions at the kitchens when you cook, and these must be monitored. And if you have diarrhea or other symptoms, you should not cook yourself, and please abide by such quarantine measures. COVID-19 pandemic has spread throughout the world, and it has been 6 months. And now we have globally we have surpassed the 10 million mark, and the fatalities also have rose to over 500,000. And we see significant increase in the number of confirmed cases in the US, Brazil, and in many other countries. We are seeing a second wave. And many countries are now preparing for a prolonged battle against COVID-19, and they are also contemplating on the balance between quarantine and daily routines. And since the first case has been identified here in the country on January 20th, we are also exerting our full efforts to contain the virus to its full extent. We are also maintaining the condition to be under our medical capacity so that we do not have great damages done to our society. And the government, centering around the KSDC, we are also providing sustainable and effective and practical solutions based on scientific evidences. And together with the experts, we are also revamping our guidelines and protocols for the people who will be discharged going forward. And also we are conducting our inspections on the medical facilities and medical resources. And we believe that on top of the government's efforts, we ask the public participation as well. And we believe that it is very important first for the public to wear face masks on an individual level. And second is a social level. And the social level of quarantine means that we need to distance ourselves and decrease the risks of infection. However, as we noted earlier and seen in the cases of door-to-door sales outbreak as well as religious religious centers. We are seeing a significant increase and continuous increase in the number of patients, especially in the senior middle age to senior age group. And within the challenges posed by the COVID-19, please note that many people are exerting their full efforts to protect the society, and please refrain from social gatherings and social meetings for the sake of yourself and your family members. And please abide by quarantine measures. Thank you very much.
Right, that was Chung Young, the head of KCDC, with the government's afternoon briefing. So is back to give us a summary.
All right. Well, Chung mentioned how the new cases, the 42 new cases, were not only concentrated in the metropolitan area where over 20 cases occurred, but also in Daejeon and even in Gwangju in the south of the country. And that is because many of these new cases are linked to cluster infections at small churches and other religious gatherings, which is why Chung again reiterated guidelines for people who are going to such religious services. And that's why she called on online services as well as to reduce the number of participants at such gatherings, and also to make sure to wash hands and also use face masks and try to refrain from chanting and eating to avoid transmissions through respiratory droplets. And Chung also mentioned how the government is now going to release once a week statistics on the latest figures that it will compile over the weekend. And those recent figures showed that local transmissions are in the decline, but imported cases are again on the rise. And we also had a dozen of these today, including from the US, Europe, and Asia as well. And last but not least, she also mentioned how the world has now more than 10 million cases and 500,000 fatalities in just the span of 6 months. And that is why until a vaccine comes out, we will have to stay vigilant, and that's also why the government has been releasing those 3-level social distancing schemes over the weekend. So we might also go to level 2 if we have a rise in cases.
Right, so hopefully that will not be the case. Thank you for that. I'll see you again tomorrow.
See you tomorrow.
Meanwhile, public transportation authorities are boosting their efforts to keep the virus at bay by ensuring the proper and regular disinfection of vehicles and by calling on passengers to abide by safety practices, including the wearing of face masks. Now, we were at one railway station recently to see these quarantine measures in action.
Public transport, where a large number of people mingle in enclosed spaces, is one of the highest risk areas when it comes to the spread of the epidemic, which is why they need prevention measures of the largest scale. With staff members at SRT, or Super Rapid Train, doing everything they can to fight the COVID-19 pandemic, our news team paid them a visit. With 60,000 people coming and going every day, staff at Susa Station have been carrying out a particularly rigorous program of preventive measures. From painstakingly thorough checkups and disinfection to COVID-19 instructions in sign language, they really are leaving nothing to chance.
역사에 대해서는 고객들이 이용하는 모든 시설물과 입점 상하들을 대상으로 하루 3회 이상 수시로 방역 활동을 전개하고 있습니다. 또한 역사 내 고객 주요 이용 장소에 대해서는 손소독대를 비치하였고 열감지 카메라 설치를 통한 이용 고객 모니터링을 시행하고 있습니다.
Disinfecting the station is one thing, but keeping the train carriages safe is quite another, as that's where passengers mix for much longer and in much closer proximity. With the last passenger disembarked, they have only 1 hour to disinfect the entire train before it has to go out again. Disinfecting staff members work every inch of the carriage, from doors and seats to every nook and cranny.
수서역에서 출발할 때 소독을 한 번 하고 출발을 하고 부산역에서도 한 번 해가지고 다시 올라오고 그렇게 반복적으로 4회 정도 하고 있습니다. 다음 손님이나 고객들한테 전파나 그런 것이 되지 않도록 열심히 노력하면서 작업을 하고 있습니다.
Following the government's plan to strengthen pandemic prevention in public transport, face masks are now mandatory in stations and in train carriages. On the train, there are face mask vending machines for those who've forgotten to bring one.
마스크를 깜빡하고 입고 왔는데 간편하게 자판기에서 사서 쓸 수 있어서 좋고 마스크 써서 이제 좀 사람들 많은 곳에서 안전하게 갈 수 있어서 되게 안심이 되는 것 같아요.
With Korean society continuing to battle against the ongoing COVID-19 pandemic, it is thanks to those on the front line of public safety that we are able to travel virus-free.
참모부가 당중앙군사위원회 제7기 제5차 회의에 제기한 대남 군사행동 계획들을 보류했습니다.
남북 간 체제 경쟁은 이미 오래전에 끝났습니다. 우리의 체제를 북한에 강요할 생각도 없습니다. 우리는 평화를 추구하며 함께 잘 살고자 합니다.
Following weeks of hostile rhetoric, North Korea now appears to have taken on a relatively calm stance. So what lies ahead for cross-border ties? Well, to answer that question, I have Dr. Kim Chang-soo from the Korea Research Institute for National Strategy. Welcome to the program, Dr. Kim.
Thank you for having me on.
And I also have Dr. Woo Jung-yeop from the Sejong Institute. Welcome, Dr. Woo.
Thanks for having me today.
Now, I'll start with you, Dr. Kim. Following North Korean leader Kim Jong-un's suspension of military action plans against South Korea, there also appears to be less harsh rhetoric against its southern counterpart. And for the third year, that is, in a row, anti-US rallies, which were normally held on the 25th of June to mark the Korean War, have not been held. How do you interpret these latest moves by North Korea?
You know, people said this has been something unexpected from North Korea, but I think this is a highly calculated maneuver by North Korea because they were looking what's going on in the South Korea and also in United States and many other countries because they were all kind of pressing, kind of more maximum pressure again on North Korea. Economic sanctions going on and beginning to work. And there is also a coronavirus infection, including himself, because he's hiding away from the scenes for many weeks right now. That's why we see so many confusing messages from Kim Yo-jong and Kim Jong-il. But now Kim Jong-il finally said that we're going to suspend all these military actions vis-a-vis South Korea for their own political gains. So we have to wait and see what's the real intention. But this shows how multiple crises they are facing right now. The health problems and the economic problems and also the production of North Koreans' rice, and I think people beginning to call there might be another period of what they call the arduous march in North Korea. So that terrible situation really prompted North Korea to act very different at this time. That is, suspend all these military actions vis-a-vis South Korea, but we are not going to drop it for good. We are going to come back if we find it more interesting to us.
Right, that is what the North Korean leader Kim Jong-un has said, to suspend those military action plans for the time being. Dr. Woo, in his speech to commemorate the 70th anniversary of the cross-border conflict on the peninsula, President Moon Jae-in extended an olive branch to North Korea. And he also spoke of efforts to end the war. Are these words a renewed commitment to bring a formal end to the Korean War?
South Korean government has never stopped its commitment to bring a peace on the Korean peninsula and has been offering these kind of olive branches to North Korea since the resumption of talks in early 2018. So in 2018, that when inter-Korean talks and the U.S.-North Korea dialogue has started, the South Korean government proposed the idea of the exchange between declaration for declaration, which means that declaration to end the war can be exchanged, the declaration for North Korea's nuclear program. However, it has not been well accepted by North Korea because South Korea has been saying that the declaration to end the war is only symbolic. So it's not legally binding to anyone involved in a Korean War in 1950 to 1953. So I think that even though South Korean government has offered this idea again to North Korea, but it's very difficult to see that North Korea is going to be responding productively.
And speaking of North Korea's response, Dr. Kim, do you think North Korea will accept the olive branch this time?
No, I don't think so. It's highly unlikely for North Korea to accept the olive tree again, olive branch again, because this kind of proposal has been around actually for the last 2 decades since the Kim Dae-jung administration. But again, North Korea was very hesitant to accept it. But finally, this is quite surprising to me because, as a matter of fact, North Korea made a rebuttal the next day. President Moon Jae-in made this kind of proposal again to North Korea because many people assumed that they might take this bait or this kind of good-sounding proposal to North Korea again. But all of a sudden, they flatly reject this idea from the Moon administration because they are thinking of the South Koreans. By giving this kind of negative impact on the North Korean, South Korea's Moon Jae-in government, they might have much more leverage over the Moon administration, and also they might defy the South Koreans from the left and right and along the conservative, liberal ideology continuum. So this is a very highly calculated strategy by the North Korean leadership to, reject temporarily this kind of offer by President Moon this time.
Now, for further insight on cross-border affairs, I have Henry Ferrone, a senior fellow at the Center for International Policy, which is located in Washington, live on the line. Hello, Dr. Ferrone.
Hello.
Dr. Ferrone, can you hear me?
Yes.
Right, Dr. Ferrone, there are some who say North Korea's recent shift in stance is related to former U.S. National Security Advisor John Bolton's publication. Do you agree?
In my view, Bolton's revelations did not play a significant role here because the policies that North Korea is taking issue with here have remained the same even after he was fired 9 months ago. What North Korea has been doing in the past weeks, as I see it, is to protest the delay in implementing the Inter-Korean agreements of 2018. So there's been talk of an end of war declaration, a peace agreement, Inter-Korean economic projects, face disarmament, etc. And from North Korea's perspective, there has been too little progress on these issues, and the recent escalatory measures were meant to signal that it would withdraw from them if the stalemate continued. And in that sense, I believe it's suspended escalation to give South Korea time to react.
Right. Dr. Ferrone, U.S. President Donald Trump was at the Korean War Veterans Memorial in Washington last Thursday to mark the 70th anniversary of the Korean War. Now, this was the first such tribute since he took office. How do you interpret this visit?
The Trump administration has kept a low profile because the current tensions are, in a way, linked to its maximum pressure policy. So the State Department has released short statements saying that the United States supported inter-Korean cooperation, but that cooperation should proceed in lockstep with progress in denuclearization. And what this means is that Washington wants Seoul to continue delaying the implementation of inter-Korean agreements, which is exactly what Pyongyang is complaining about. And in this sense, it leaves South Korea in a difficult position, and the visit at the Korean War Memorial is maybe a subtle message to say that alliances involve sacrifices.
Mm-hmm. Dr. Ferrone, what do you believe are the variables then that could affect U.S.-North Korea relations in the future?
Well, I see little sign at this point that the Trump administration is veering away from maximum pressure. As I just mentioned, the State Department continues to insist, as it did in 2018 already, that South Korea continue helping maintaining this pressure. on the north. As for what to watch in the immediate vicinity, I guess, I think Pyongyang's focus here really is Seoul. Pyongyang has made repeatedly clear that it doesn't want to negotiate with the United States anymore, unless it is for peace talks. Given everything that's happening in the United States right now, I doubt that President Trump would have a lot of bandwidth to deal with North Korea at this point. And so the key variables that I see right now are the extent to which President Moon Jae-in is willing to make constructive steps, and the extent to which he can try to persuade the United States that having good inter-Korean relations ultimately is good for both South Korean and U.S. security. At least that is my conviction.
I see. All right, Dr. Farron, thank you very much for sharing your thoughts with us at this hour live.
Thank you. It was a pleasure.
Dr. Woo, there are those who believe that the ROK-US working group, which was established to ensure a nuclear-free peninsula, is in effect hindering cross-border engagement. What are your thoughts on this?
So ROK-US working group became very controversial after North Korea made a statement criticizing South Korea is resorting to ROK-US working group even before the ink on an agreement dried out. But the fact is not true that ROK-US working group cannot impose any sanctions on inter-Korean project, nor it can block any project by itself. It's blocked because of the sanctions, not by ROK-US working group. So I think that the ROK-US working group actually helped South Korean government to go ahead with the inter-Korean project. So far, South Korean government acquired a waiver, sanctions waiver from the working group on 12 cases. However, only 4 cases could follow through because North Korea has not responded in 8 cases. So the problem is not on the working group, but the reciprocal measures has not been taken by North Korea.
Right. Now, Dr. Kim, Dr. Farron also talked about COVID-19 overwhelming North America, that is, which is why they cannot focus perhaps on cross-border ties as much as they would like to. Could South Korea use this current COVID-19 pandemic to leverage its engagement with North Korea, do you think?
Theoretically, it's possible, and it's good actually if you propose some aid to North Korea because they definitely need it. But the way I think the problem lies with North Korea because they don't want to be seen as a kind of recipient of the aid from South Korea when they have no coronavirus infection after all. So they say, and there is a very clear state, and they just denied all the existence of the virus. And Mr. Kim Jong-un also doesn't wear a face mask in public. So this is a terrible situation. How terrible situation they are facing right now. Theoretically, they can accept because if we provide some humanitarian assistance, North Korea it may be exempt from the international sanctions on North Korea. But on the other hand, it really damage on their egos because we are very proud and very good country, the paradise on earth. But they are accepting some very public aid from South Korea. The enemy become again the enemy of North Korea because given this kind of frame of adversarial relation between the North and South Korea, they are unlikely to accept, at least in public, some donation, even though it's a very humanitarian, sanitarian. So I think it's unlikely. So it gives another additional problem for the Southern governments to offer this kind of very good meaning gestures to North Korea.
Right. And staying with COVID-19, it's not just the US that's being overwhelmed, actually. Our partners interested in regional security, including China, Japan, and Russia, they're all overwhelmed by the virus, as we are, of course. But how does this reality affect cross-border ties, do you think, Dr. Woo?
So the countries like US, China, Japan, and Russia, the neighboring countries around the Korean Peninsula are all tied up with the handling COVID-19 and COVID-19's influence on their own domestic politics. So for example, that in the US, President Trump has all the things on his dishes right now that he doesn't really have time to bring up the North Korean issue when North Korea has not responded positively on the dialogue with the United States. So even if President Trump wanted to bring this issue up again, but if North Korea doesn't respond positively, then there is no use of bringing this issue for President Trump's domestic political agenda, especially when he faces election in 5 months later. So I think that all the countries, when they are tied up with the domestic politics and handling domestic economic crisis, it's difficult for us to expect them to have more agenda on North Korean issues right now.
Right. Dr. Kim, what are your thoughts? Does this reality, the absence of active interest from our regional partners, offer South Korea perhaps the chance to take the driver's seat in charting a course for cross-border ties?
Oh, I'm not that naive, or I'm not that hopeful, because given the situation we are facing right now, it's not just the United States, but Russia, China, and South Korea, even South Korea, because we have a long way to handle with this coronavirus. And there's a long way, nobody knows when we will have some access to the vaccines or therapeutics. Still we are in we have to take care of our own cases and reduce the number of death cases. So I think this really should be the number one priority for all countries, including ourselves. So as I really agree with Dr. Wu, because all the surrounding countries, because they are the number one, number two, and number three in a huge cases country in the world, and the election is coming up, and they don't have any room for this kind of, because they believe this will produce almost nothing again, because we have gone the same way path for the last 2 or 3 years, and they want to repeat this process again, particularly for Mr. Trump, who is facing a serious difficulties with the re-election, with Mr. Joe Biden coming up, and with the second wave of coronavirus across the United States. And I think that is also with Mr. Xi Jinping as well, because they have a second wave of coronavirus around Beijing, and also all kind of natural disasters kind of happening simultaneously in North Korea. So given this all kind of domestic crisis, multiple crises, I should say, these leaders have no room for paying their attention to the North and South Korean issues. From our perspective, this is very important, but I think to be very honest with, to be practically speaking, this is not a number one priority for all these countries.
Right. Doctor, South Korea and the US are poised to hold joint military drills in August. Now, given the status quo, do you believe these drills will be held? And if they are held, what impact would they have on cross-border ties?
After the explosion of Kaesong Liaison Office and with the series of hostile statements from North Korea, there was a discussion of possibly resuming the joint military drills in August with the width and depth of 2017. So like General Vincent Brooks, like former the command of Combined Forces Command, said that we have to resume the military drills as we did in 2017, which scared probably North Korea. But as North Korea toned down their attitude towards South Korea right now, that I'm not sure what kind of discussions are being held between South Korea and the United States. So even if we are going to hold a joint military drills in August, maybe we are going to scale down a little bit, or we are not going to make a propaganda out of it, because the purpose of the joint military drill has been like twofold. First, exercise itself, and second, sending a message toward North. So maybe even if we are going to have the joint military drills as we plan, but we are not going to be a hugely sending a message to North Korea this time.
Right. One final question, Dr. Kim. Now, given the circumstances so far, what, in your opinion, would be some practical ways in which South Korea could seek to engage its northern counterpart? Yes, it's a very difficult question, I understand.
Stick to the same proposition, same stance toward North Korea, and treat them as our brethren in the north. And if maybe they are probably disappointed with the lack of progress in our relationship, probably mainly due to their own problem, not us. We are pretty much willing to support him, but now they are finally rejecting our offers for domestic reasons. So if they come back to normal, kind of normal again, if Mr. Kim comes to a kind of good, normal situation around him, and if everything goes all right, then might come up to us for our, again, going to the kind of military exercise we are facing. Actually, we have reduced and canceled the military exercise with the United States for good reason. And if you look at the September 19th military agreement, there was a condition that if North Korea, if any side breaches this, any clause of the agreements, both sides may agree to resume our military action, including military exercise with the other side. So this is exactly what's happening for the last 1 or 2 weeks. And
Right.
At the end of August, we are going to see maybe another military exercise. It is not a military exercise in the field in the terms of the traditional terms of, this is a computer military exercise, and all the governments should be involved in this kind of exercise, and under a different name, I would say. And this is, again, because one thing that we have to add this scenario is this is a kind of coronavirus added to it. So how are we going to respond to coronavirus in South Korea and North Korea, and how we're going to minimize the impacts of this kind of coronavirus? I think this is tremendous military implications on our exercise.
Right, that is a priority, the COVID-19 pandemic. All right, Dr. Kim, thank you so much for your thoughts, and
My
Dr.
pleasure.
Wu, thank you for being with us today.
Thank you.
My pleasure.
Right, well, that brings us to the end of Monday's edition. Do tune in tomorrow as we address growing concerns of a second wave of COVID-19 by gauging the current situation and by exploring the new measures to tackle the pandemic. In the meantime, do reach out to us with your thoughts and inquiries through our social media accounts or our homepage, arirang.com. Thank you for watching.